Today I'm going to talk to you about epilepsy. What is epilepsy exactly? Well, it's a neurological condition that affects the nervous system. This can cause seizures, which are disruptions in the electrical activity of the brain that cause temporary changes in movement, awareness, feelings, behavior, or other bodily functions. So what are the causes exactly of this? Well, in about 60% of the cases, the cause is unknown. In 40% of the cases, though, it's because of either genetic influences, traumatic brain injury, brain conditions such as a tumor or stroke, drug or alcohol abuse, infectious diseases such as meningitis or encephalitis, or prenatal or birth trauma. So there are actually 40 different types of epilepsy. The first is infantile spasms, which usually these are around 3 to 8 months of age. And in most cases, they'll usually begin about by the age of 1 and stop by the age of 2 to 4 years old. Next, we have childhood absent epilepsy, which these usually have staring spells and the child is not aware or responsive. Their eyes may roll up briefly and each spell lasts about 10 seconds and then will end abruptly. Last of all, we have juvenile myoclonic epilepsy, which is very generalized and usually will emerge from mid to late adolescence. It's characterized by the presence of absent seizures, myoclonic seizures, and generalized tonic-clonic seizures. There are also 20 different types of seizures, the first being tonic-clonic seizures, which is the most dramatic type of epileptic seizure because it can cause an abrupt loss of conscientiousness, body stiffening, and shaking, and sometimes loss of bladder control or biting of the tongue. There's also absent seizures, which often occur in children and are characterized by staring into space or subtle body movements such as eye blinking or lip smacking. Then there's also simple partial seizures, complex partial seizures, and myoclonic seizures, which are usually appearing as sudden brief jerks or twitches of your arms and legs. The symptoms usually associated with epilepsy are temporary confusion, a staring spell, uncontrollable jerking movements of the arms and legs, loss of conscientiousness or awareness, or convulsions. Some of the diagnostic tests that might be done is a doctor could review your symptoms and medical history. They might also do a neurological examination and some blood tests. But to look at your brain, they might suggest one of the following. The first maybe being a EEG, which is the most common test used to diagnose epilepsy. In these tests, doctors attach electrodes to your scalp with a paste-like substance. The electrodes then record the electrical activity of your brain. If you have epilepsy, it's common to have changes in your normal pattern of brain waves, even when you're not having a seizure. Your doctor may monitor you on a video while conducting an EEG while you're asleep or awake to record any seizures you may experience. Recording the seizures may help the doctor determine what kind of seizures you're having or rule out any other conditions. The second type of test they might do is the CT scan, which uses an X-ray to obtain cross-sectional images of the brain. And it can reveal abnormalities in your brain that might be causing your seizures, such as a tumor, bleeding, or cysts. The third type is a MRI that they might do. And these are powerful magnets and radio waves that create a detailed view of your brain. Your doctor may be able to detect lesions or abnormalities in your brain that could be causing your seizures. The fourth type is a PT scan, which uses a small amount of low-dose radioactive material that's injected into a vein to help visualize active areas of the brain and detect abnormalities. The last is a SPEC test, which is used primarily if you've had an MRI and EEG that didn't pinpoint the location in your brain where the seizures are originating. The prevalence of this illness in the United States is that it is the fourth most common neurological problem. It accounts for about 5 to 8.4 per thousand people per year, which is around 1.3 to 2.8 million people. This is about 1% of the population. The demographics of this illness are that it affects all ages of both men and women, but most commonly it's found in young children because of trauma or a tumor, or it's found in older adults because of a stroke. The treatment options for this illness are either anti-seizure medication, brain surgery, which is most commonly done when tests show that your seizures originate in a small, well-defined area of your brain that doesn't interfere with vital functions such as speech, language, motor function, vision, or hearing. In surgery, your doctor removes that area of your brain that's causing those seizures. Or they might do some kind of therapy, such as ketogenic diet is most often prescribed to a child to reduce their seizures by following a strict diet that's high in fats and low in carbohydrates. Another option is the vagus nerve stimulation, which is usually a device implanted underneath the skin of your chest that's similar to a heart pacemaker. The wires from the stimulator are connected to the vagus nerve in your neck, and these are usually battery powered, so it sends bursts of electrical energy through the vagus nerve and to your brain to reduce the seizures. The other option they might do is a responsive neurostimulation, which is a treatment option that's a fairly new approach and is usually used for uncontrolled partial onset seizures. This automatically monitors brain signals and provides stimulation to abnormal electrical events when it's needed. This is placed under the scalp and within the skull. The neurostimulator continuously monitors the brain's activity and is programmed by the epilepsy doctor to detect and record specific patterns that could lead to a seizure. When these patterns are detected, the neurostimulator responds with brief pulses of stimulation intended to disrupt the abnormal brain activity before a seizure occurs. Detection and stimulation settings are individualized for each patient's pattern so that the stimulation is not felt. In addition, each patient gets a take-home monitor so that brain activity data can be sent to the epilepsy doctor between office visits. The age group I'm going to specifically focus on is the preschool and early school age child, which are usually about 4 to 7 years old. They're in the psychosocial initiative versus guilt stage, and they begin to assert their power and control over the world through play and other social interactions. They also have this imagination that continues to grow, and they tend to ask a lot of questions. In the cognitive realm, they are in the pre-operational stage, in which they have mental operations that cannot be performed mentally in their mind. They also really enjoy symbolic play. In the area of their development, we see physically they are going through sex identification and they start to have control over their movements. They specifically are working on gross and fine motor development. Gross motor development meaning skills involving the movement of the large muscles in the arms, legs, and torso. These include walking, running, skipping, jumping, throwing, and climbing. In fine motor development, they are working on the coordination of their small muscles in their hands and fingers. These are needed for writing, cutting, and tying shoelaces. They also typically are about half the size of an adult. And cognitively, we see that they have concrete thought and their egocentrism shifts to social awareness and magical thinking. They also tend to have limited internal understanding of how the body works and can use almost completely mature speech, while also having some writing skills. Now, in the area of social and emotional development, they kind of know what is right and wrong, and they start to develop empathy for others. They also have this increased independence and can understand rewards and punishment. They will model and imitate others' actions, and they learn what are socially appropriate behaviors for being in public. They also use associative and cooperative play. Some issues related to hospitalization is that they have a loss of control over their environment. They also are afraid of injury because they believe they will lose body parts, and they perceive their illness and procedures as a punishment. They also typically have separation anxiety, and they don't like that there's no consistency in their schedule. They feel like they have a lack of independence to explore their surroundings. So So, some developmental considerations to consider are to try and incorporate the child as much as you can in daily activities. Also, try and provide choices whenever it's possible. As a child life specialist, it's really good to explain things in concrete terms by using the senses. Also, try and incorporate expressive medical play and try and clearly explain the body and all its functions so that you can show them that their illness is not a punishment. Try and support the parental involvement as much as possible and provide opportunities for peer interactions. The resources for this would be some books, and a couple I found were Let's Learn with Teddy about epilepsy, The Adventures of Oscar, Oscar's New School, and Lee, the Rabbit with Epilepsy. I also found this activity that's called Get Going Gang Coloring Book, which is basically talking about epilepsy, and in the process they get to color. So, how does epilepsy negatively affect development? Well, cognitively, it will affect their language and how fluent their words are. It will also affect visual spatial memory. They will have deficits in their visually sustained attention. They will have delayed recall. They'll have learning problems, such as they will be reading slower and their writing abilities are maybe not as developed as other kids. They also have some social isolation most of the time because they're teased for having seizures at school. Some child life interventions I would do is some healthcare play activities, such as I would have this child squirt paint on a piece of paper with syringes. After they got done with that, I would have them fold the paper in half and then open it up to see the design. My goal from this interaction is for them to familiarize themselves with some of the medical equipment that can be used to give them medication, either by an injection or IV for their epilepsy. This play activity would also allow them to feel autonomous, since they would get to pick the color they want to do their picture, and they would also get to practice their motor skills. The other one I might have them do is decorate an IV pool, since this is where they get all of their medicine injected into their body. This could be decorated in various ways, such as with paper chains, flowers, or photos. The goal for this interaction is to make sure the child feels at home if they are going to be in the hospital for an extended stay. This could happen to a child with epilepsy if they have to have surgery because their medication isn't working anymore. This activity would also allow them to have some cooperative play, since all the patients would have the common goal of decorating their medical equipment. This is a good activity for this age group because they can do a lot of fine motor skills with considerable speed and efficiency. Then I might prep a child for an EEG with using dramatic play. I would use this to bring in a medical doll, and I would have them put electrodes on it, and then I would say we are going to measure the activity of what is going on in the brain. Then I would show them all the squiggly lines that appear on the box as it measures the activity going on in the doll's head, telling them how there is no pain involved in this process. The goal of this interaction is to help them act out a situation that would be happening to them in the hospital. I picked this activity because it incorporates make-believe play. This allows the child to pretend they are a doctor who is taking care of a patient. They would also develop more of an understanding of how the body functions when they practice using the medical equipment. Then I might use a distraction technique such as deep breathing or reading a book to them. Last of all, I might teach about IV prior to an insertion for medication. The first step I would tell the child is how I'm going to put a really tight band around their arm. Then I would tell them that I'm going to clean out their arm with a wipe. After that, I will poke the arm and only leave the straw in there. Then I will take the rubber band off and put tape on their arm to keep it in place. Another thing I might try is a school re-entry program if the child is having a hard time in school. Finally, this is my reference list with all the sites that I used in my presentation to find my information.